Welcome to Prescription for Primary Care. I'm Natasha Tranos, your host for today's episode. I work with Healthion as an external marketing and communication specialist to help revolutionize primary healthcare in Canada. Today, I'm very excited to be joined by Colin Craig, president of secondstreet.org, a new think tank that focuses on telling the stories of Canadians and how they're impacted by government decisions. Colin, thank you so much for joining me today.
Well, thanks for having me.
So this year, secondstreet.org released Health Reform Now, a documentary about Canada's broken healthcare system. Colin, could you give our listeners an overview of what Health Reform Now covers and what your main goals were in creating this film?
Sure, yeah. So I don't think it's any secret that our healthcare system, pretty much from coast to coast, is in a crisis. Far too many patients are falling between the cracks each and every day in this country. And that's not to say that no one ever has a positive experience with the healthcare system. Certainly it happens. There's lots of good people that work in the system. It's doctors, nurses, and in other capacities, and they work hard to try and help patients. But like I say, the problem is too many patients are falling between the cracks, and this has become a pretty well-known problem in the country. And we thought, well, let's try to create a relatively short documentary. It's about 40 minutes long that really examines the problem, but heavily focuses around solutions. And the solutions we look at are in use throughout Europe, where they have universal healthcare systems that are performing better than Canada's. So we wanted to examine those and give viewers a quick briefing on some of the things that we could do to improve our system.
Yeah, thank you so much for sharing. Yeah, it's pretty clear. We see it every day in the news and online. A lot of patients are falling through those cracks and not getting the care they need. So, in the documentary, I know it cites a lot of data and statistics around wait times and patient outcomes. Could you talk a bit more about some of the key findings, maybe, that stood out to you and your team when looking into this?
Yeah, so I think one of the most important things for people to keep in mind is that there's a lot of money that's spent on healthcare in this country. Canada is one of the top spenders on healthcare in the world. So when you see stories online about healthcare, even when we make posts on our social media pages, people will chime in and they'll say, well, it's because of the cuts or there's not enough funding or whatever. And these are the claims, but they're just not backed up by evidence. So one bit of information that I think is important is that governments across Canada fund what's known as the Canadian Institute for Health Information. So that entity's money comes from NDP governments, liberal, conservative, it doesn't matter. It's coming from governments that are run by parties across the political spectrum. And what that entity tries to do is take a look at the healthcare data. And that's their conclusion, is that we're one of the top spenders in the world.
Yeah.
Other organizations have come to similar conclusions. So there's a lot of money in the system. The problem is we're not getting the best results possible because of the structure of the system. If people think about an organization that just isn't run very well, but has good people working for it, that's essentially healthcare in Canada. It's just we don't have the right structure. It's not run very well. We don't have the right options available for patients. And so we end up with results that are lagging other developed countries. I mean, one great statistic is you look at, and I'll try to remember the figures roughly off by memory here, but when you look at people waiting in the healthcare system to maybe get their hips done, their knees done, those types of procedures, the wait times have grown exponentially over the past 30 years. Fraser Institute data shows that it's gone up by roughly 3 times what it used to be. People used to wait somewhere around 8 weeks from the time that you were referred to a physician until you actually get, or to a specialist until you actually get the treatment. Now it's up to over 27 weeks. I think it's close to about 28 weeks on average. So we have this graphic in the documentary where we show the wait times have gone up, and at the same time, spending has gone through the roof. So we're just throwing more and more money at the system, and things are getting worse and worse. So that's one of the statistics that I hope really puts people back in their seats to kind of realize, hey, wait a second, we can't just throw money at the system and hope things work out. We've got to look at structural reform.
Yeah, absolutely. You're left with a lot of frustrated patients. I noticed in your documentary, I think it was someone waiting for a knee surgery, and it was weeks and weeks, and it's frustrating. People are stuck kind of in this like lump of what do I do now? I'm not getting the care I need, and it affects their everyday lives. So it's not good, and just throwing money at it, like you said, is not gonna magically fix it. I know one of the solutions you highlighted in the documentary, it's activity-based funding for
Mhm.
healthcare providers. Could you maybe explain how that model works and why you think it would be beneficial for Canada and Canadians?
Sure. So what happens right now, if you think about how hospitals are funded in Canada, generally speaking, what happens is governments will give those hospitals a big check each year. Maybe it's $100 million or 200 million, whatever the amount is. They get the big check, and then those hospitals are told, "Okay, good luck. We hope you can help a lot of patients this year." And that's not a very cost-effective way of funding healthcare. So in other countries where they have better performing universal healthcare systems, what they will do is fund hospitals differently. They will say to them, every time you help a patient, we'll give you a certain amount of money. So if you deliver a baby, for example, you might get, say, $4,000. If you do a knee operation, well, maybe you get, say, $12,000. And each time you do those procedures, you get more and more money. So you've turned the entire healthcare system on its head. Now it's about helping patients, and the money follows the patient. So right now we'll hear stories from patients where they say that they called the specialist office and they didn't get their phone call returned, or someone was rude to them or whatever. I mean, these things happen in the healthcare system. But when you switch to the model I just described, activity-based funding, where the money follows the patient, now that relationship is different because the hospital will look at each patient walking through its doors as someone that they want to help. They want that patient to come to them for care because then the hospital gets money if they help the patient. So you start to see things happen in activity-based funding, like patients getting their calls returned
Yeah.
sooner. They're treated with more respect. The hospital itself will focus their activities around helping patients because that's what brings the money in. Whereas right now, you'll see hospitals spending money on administration. One surgeon we talked to in British Columbia kind of rolled his eyes and he said that, you'll see hospitals, changing their computer systems again and again and again, kind of thing, rather than, focused on activities that help patients. Under
Yeah.
activity-based funding, you might see money spent on hiring additional doctors and nurses because those are people that actually help patients rather than more administrators. In
Yeah.
Ontario, there's in the Windsor Hospital, they have lost over $2 million running their own Tim Hortons. So you walk into the hospital, there's a little Tim Hortons there. It's run by government hospital staff, and they've lost, like I say, nearly $2 million
Yeah.
over the last 10 years or so.
Wow.
And so what that means is that that money that was given to that hospital to help patients was wasted on subsidizing someone's double double or their donuts, which is not what dollars in the healthcare system are meant for. So under activity-based funding, the mindset changes in hospitals. They become very focused around how to do things very cost effectively to help patients, help as many patients as possible, because ultimately that's what brings in the money.
Yeah, it's putting the patients ahead, which is what Canadians are looking for. That's great.
Mhm, mhm.
Um, Colin, another interesting proposal was the idea of allowing Canadians to seek treatment abroad and get reimbursed, which is similar to the EU's cross border directive. So,
Mhm.
what are your thoughts on this approach? I found this very interesting. When I watched the documentary, I'd never heard of anything like that, but it was very interesting to learn about.
Yeah, so we talk with a lot of patients each and every year, and a patient from Manitoba actually drew our attention to this policy. We thought, well, this is actually really fascinating. It's a good idea that we should be copying here in Canada. So, what happens in the European Union is a patient has a choice if they happen to face a long wait time somewhere in the European Union. They have another option. Well, they have multiple other options, but they can wait for the government to provide care locally. Throughout the EU, they do have the option of paying for private care locally if they want to. But then there's this other option they could take advantage where they can go to another European Union country, pay for treatment, and then get reimbursed by their home country. So if you're a patient in, let's say, Ireland, and you're waiting a long time to get your knee done, You could go to maybe France or Germany or some other EU country where instead of maybe waiting, let's say 4 months in Ireland, maybe that clinic in France can get you in next week. And now you can get your surgery done. You can get back to work. You can get back to living your life, cuddling your grandkids, doing whatever that
Yeah.
people want to do in their lives instead of waiting for months and months on end. So here in Canada, where we often measure wait times in years, just imagine how this could change things for patients. Some patients might decide, yeah, I'm going to go abroad and I'm going to get my knee done or my hip done or cataract surgery or whatever, and I'll get my life back sooner. And ultimately, it helps that patient. But it also helps patients who don't want to travel. Some people don't want to travel for healthcare, and that's totally fine. They would benefit because on the waiting list that they're on, some people ahead of them in line would decide to travel. And when they travel, they leave that waiting list and everyone else gets to move up.
Yeah.
So there's a real win-win opportunity there. One of the important safeguards to note for governments is that in the European Union, it's not just a blank check where patients can go wherever they want, spend whatever they want. The government reimburses up to the same cost that they would spend for that particular procedure locally.
Okay.
So it doesn't cost governments more money. What it does is it changes the timing for when patients can get care. They can get it a lot sooner. And like I say, get back to work, get their lives back, whatever.
Yeah, that's very interesting. Did you say a patient brought that up to you in Manitoba?
Yeah, it was a patient from Manitoba, actually. He ended up going to Lithuania to get
Oh,
his
wow.
knee done. And he actually found that the numbers that he researched was that the cost of the knee procedure that he required, it typically costs the Manitoba government somewhere around $21,000. He got it done in Lithuania for, I think he said it was around 14,000.
Wow.
It was actually less expensive
That's incredible.
and high quality treatment. He's happy with it. He's got his knee back. He's got his life back, and it certainly worked out well for him. So if we start to think that way and give patients more options,
Mhm.
suddenly instead of just depending on what is available in your province, patients could start to look at other provinces and go there and pay for treatment and get reimbursed. South of the border, of course, to the United States, over to Europe. Talk to patients that have gone to high quality clinics in Mexico, people that have gone over to China, Thailand. I mean, people are going all over the world. Canadians are going all over the world for treatment. And this would be one way that, could certainly help more people afford to actually do this.
Yeah, that's incredible that a patient brought it up to you. It makes me kind of think of cosmetic procedures and how that's pretty popular to go overseas and do. I never would have even thought for a knee surgery, hip replacement, cataracts, anything like that. So that's it's very interesting. And it's interesting to see that patients are taking the step to look for other resources to get these surgeries done and see these specialists because it's just not happening quick enough here. So that's
Of
very
course.
interesting. So looking kind of beyond the specific solutions you covered in the documentary, what do you see as sort of the biggest roadblocks to healthcare reform in Canada, whether this be political or ideological, that you might have come across?
Yeah, I think the biggest problem that we face in Canada is that a lot of politicians, I think their mindsets are still stuck, 20, 30 years ago, where people were more reluctant to see health reform.
Yes.
Um, the public opinion has shifted on this issue. The public is overwhelmingly supportive of trying new things. They're ready to see reform. They understand the status quo doesn't work. Throwing money at the system and hoping that it will get better doesn't work. So the public is ready for reform. And I think largely we've seen the elected class fairly timid on this topic. They're not moving forward fast enough with changes that work well in other countries. The good news out of all this, Natasha, is that we don't have to reinvent the wheel. We can see what other countries that perform better than Canada, what they're doing right, and just copy what they're doing and
Yeah.
bring those policies to Canada so that we can get better results for patients. So I think that would be the ultimate thing that we need to start doing is we need to see that the political class embrace these policies that have worked in other countries. We'll do better. I would note that we have seen some positive changes happening in different parts of the country. But overall, I don't think things are moving forward as aggressively as they should be.
Yeah, absolutely. Especially as a country where we're kind of prided on as having such a good healthcare system and just seeing so many patients fall through the cracks. And you see other healthcares, like in different countries, doing so well. So why
Mhm.
not look to them for some
Mhm.
help on how we can kind of rebuild what we've created? Certainly a lot to unpack here. But before we wrap up, is there anything you'd like to share to our listeners about the work that secondstreet.org is doing, or even the vision you have for the future of healthcare in Canada?
Um, yeah, I mean, ultimately, as a think tank, what we're trying to do is just come forward with constructive ideas. And so, in that documentary, healthreformnow.ca, that's what we've tried to do. Um, I've given you an idea of a couple of things in the documentary. Certainly, there's other ideas too. I think ultimately, if we're going to improve the system, we need to see a whole bunch of things change. And we've tried to describe some of the more important things that we think would help. We also have a new website that people might be interested in visiting. It's patientoptions.ca. And what that does is it sort of recognizes that health reform takes time and a lot of patients are suffering now. So the site is meant to help people who are suffering now so that they can learn about some tips for accessing healthcare within the public system in Canada, but information on private options as well. And so we're actually going to add Healthy on to the website so that more patients are aware of what you're doing. I think it's great whenever we have more entrepreneurs coming forward to try to connect patients with health care options. I think that's good. So my hat goes off to you and Dr. Rupert and the gang at Healthion, because it certainly sounds like you're able to help patients connect them with care that they need. So that's positive. So
Absolutely. So wonderful. Thank you so much for your time today. For our listeners, make sure to check out Health Reform Now and secondstreet.org, and you can find them on their website, secondstreet.org. Stay tuned for more episodes exploring the future of health innovation. Stay informed and stay healthy, everyone.